The pain after this operation is real, and it often peaks days later on the first bowel movement. Online, the stories make it sound life-threatening, when for most people it is a hard but safe recovery. I am a colorectal surgeon, and I'll show you the real timeline and the warning signs that actually matter. As a colorectal surgeon, I do this operation, and I see people through the recovery that follows. What I'm giving you here is general education. Now, let's talk about what this operation actually is and why it has earned its reputation. The operation you had is a Milligan-Morgan hemorrhoidectomy. The surgeon removes the hemorrhoid and leaves an open wound to heal from the inside out. That open wound is the whole story. It is why the pain is real, why there is bleeding, and why the recovery feels alarming to people who were not warned. Sitting hurts. Passing stool hurts even more, and most of what you feel in the first 2 weeks is your body doing exactly what it's supposed to do. Now, online, hemorrhoid surgery gets described like a catastrophe. Stories of unbearing agony, endless bleeding, people who say it's ruined their life. Here is the problem. The people who recover smoothly rarely post about it. The ones writing are often the worst of the worst, and that is not what most people should expect. So, those stories almost never separate normal healing from a real complication. They lump a hard recovery and a dangerous one into the same terrifying pile. That distinction is the entire point of this video. So let me show you what recovery actually looks like day by day, and where the real line sits. Start with the pain, because that is what frightens people most. The wound is open, and it sits on a ring of muscle. That muscle, the anal sphincter, goes into a spasm. Spasm squeezes the raw tissue and cuts its blood supply a bit, and the pain climbs even more. Pain then triggers even more spasm. And that loop is why this hurts far more than the size of the wound would suggest. Aside from that, the area is packed with nerve fibers. The peak arrives with the first bowel movement. Stool passing over an open wound is a sharp and a burning pain. For most people, that is day 1 to day 4. It is a bit brutal, and it is still completely normal. Here's what catches people off guard. The pain is usually easing by the second week, but other things show up that people mistake for trouble. Around day 5 to 10, the wound starts shedding its surface layer. You may see yellow or gray tissue on the wound or on the paper. That is not infection, that is slough, the normal surface of a healing open wound. There is discharge too. A mix of fluid, a little blood, and wound serum, often after you sit or move. Most people need a pad for this. It is a bit messy, and it is expected. Then there is fatigue. People forget the body is healing a wound every single day, every single minute. And that quiet drain leaves you tired and low. That dip is real, and it is not a sign anything has gone wrong. Here is something almost nobody warns you about. For the first few weeks, the area just feels strange. When you wipe, you may feel lumps and swelling that were not even there before. It is easy to panic and think the hemorrhoids have already come back or you've gotten new ones. They have not. This is just inflammation. Surgery irritates the tissue and the whole area swells in response. That swelling changes how everything feels when you touch it or clean it. It can last a few weeks before it settles. So the strangeness you feel is the healing, not failure. The shape you feel now is not the shape you will be left with. So now the honest answer to the question in the title. Can this operation kill you? Almost never, but there are 2 situations where recovery stops being something you wait out. The first is a heavy bleed. As the wound sheds its surface, usually around day 7 to 14, a sealed vessel can occasionally reopen. Small blood on the paper is normal the whole way through. The signal that matters is volume. Blood filling the toilet bowl or bleeding that keeps coming is the point where waiting stops being safe. The second is infection, and here is the reassuring part. This is extremely rare. Think about what this organ handles every day. It's built to deal with bacteria, so it resists infection remarkably well. When infection does occur, it rarely arrives quietly. It usually comes with a rising fever, spreading pain, feeling unwell, and often inability to pass urine. That combination is the body telling you this is bigger than the wound. 2 situations. A bleed you can measure by volume, and an infection that is rare but unmistakable. Generally, everything else on the timeline is healing. If understanding the warning signs early is the kind of thing that matters to you, then that is what this channel is for. So picture how this usually goes for someone. The first few days are the hardest. First bowel movement is sharp and frightening, and they wonder what they have done to themselves. By the end of week 1, that pain is easing. How long that painful phase lasts depends on the size of the operation. Removing one small hemorrhoid is a much shorter recovery than clearing 3 large ones. A smaller operation can mean far less pain and a quicker turn for the better. Week 2 brings the strange part. Slough on the paper, some discharge, swelling that makes them wonder if the hemorrhoids are back. Now this can start a bit earlier as well, but nothing has gone wrong. It just feels that way. By week 3 and 4 things quiet down. The bleeding stops usually and the swelling settles, and the area starts to feel like their own again. Full healing takes longer, but the frightening part is behind them. That is the ordinary path. Not painless, but safe. Here's how I think about this operation. The reputation comes almost entirely from one thing. An open wound sitting on a muscle that has to keep working every day. And that is why it hurts. And that is why healing is slow and a bit messy. But messy is not the same as dangerous. The pain is a wound healing, not a body failing. The discharge and the slough are repair, not infection. The swelling is inflammation, not hemorrhoids winning. The genuinely dangerous events are very rare, and they are recognizable. A bleed you measure by volume, or an infection that announces itself. Everything else is your body doing hard, ordinary work. That is the gap this video exists to close, between how terrifying it feels and how safe it usually is. Now let me be fair to those frightening stories. They are not lying. For some people this operation really is brutal, and if that is your case, it is fair to accept it and to get through it. Hard cases are real, but here is what I want you to hear. Those are the exception, not the rule. In my experience, the average recovery is far milder than the horror stories suggest. Most people do not end up anywhere near the worst case picture. And what those stories almost always get wrong is the leap from hard to dangerous. A recovery can be uncomfortable and still completely safe. So if yours is rough, it does not mean you are one of the horror stories. It much more likely means you're healing exactly the way it is supposed to go. So will you survive hemorrhoid surgery? Yes. Dying from this operation is extremely rare. Remember the one line that matters. Messy healing is not dangerous healing. Other complications exist, but the ones that need you to act quickly are few. A heavy bleed or a spreading infection, and everything else you feel is your body doing hard, ordinary work.